What is foster care? Foster care provides children with an alternative to living in an unsafe environment. The minor is placed with a relative, family friend, group home, or an agency certified foster family as a substitute. Some common reasons why children are placed in foster care are physical abuse, sexual abuse, caregiver substance abuse, and the most common is child maltreatment or neglect. Who is in foster care? In the U.S. today, there is over 400,000 children in foster care. About 52% are boys and 48% are girls. From these group of children, 47% are placed with a non-relative caregiver, usually meaning they are in a certified foster family. Foster care children are faced with a range of risks that are strongly linked to the long-term deficits across multiple developmental domains. Researchers have found that there are some key factors that may hinder or influence developmental outcomes in foster children. One of these factors is emotional regulation. Emotional regulation is the process of initiating, maintaining, and processing internal feelings. Emotional regulation gives you the ability to manage attention and control. Researchers have found that emotion regulation is central to overall adjustment. Self-regulation is fundamental to dysfunctional behaviors commonly seen among foster children. Dysregulation places a child at increased risks of exaggerated reactions to stressful events. The inability to adjust and poorly react to stressful cues can lead to significant anxiety and later on aggression problems. A second factor that influences developmental outcomes is maltreatment. Children with histories of maltreatment demonstrate higher rates of academic underachievement, grade retention, poor social competence, dropout, and the utilization of special education services than among their same age peers. Several researchers have reported that children abused early in life are more likely to develop insecure attachments with their primary caregivers, which can ultimately result in deficits in emotion regulation and problem solving. Neglect is the most common form of childhood maltreatment. A third key factor that influences the development of foster youth is placement and the stability of the placement. Changes in placement or disruption rates are related to the length of a child's foster care stay, the age of the foster child, and the functioning of the foster child. Data indicate that 1/3 of foster care placements are disrupted within the first 2 years. The type of placement also contribute to the placement stability. For example, children in kinship care tend to experience more stability than others. One research suggests that children's developmental delays may lead to multiple placements. The number of placements children experience predict behavioral problems 17 months after the placement entry. The study also suggests that placement instability is linked to child behavioral and emotional problems such as aggression, coping difficulties, poor home adjustment, and low self-confidence. What research has come to find is that the negative development foster youth experience leads to high rates of aggression throughout the lifespan. A significant percentage of the nation's foster care youth have been accused of crimes or have had contact with law enforcement within the first few years after they turned 18 years old. Approximately 3/4 of the male, so 74%, and 75% of female inmates surveyed in a study in Chicago had been in foster care for 1 year or longer. About 33% of the males and 40% of the females reported being in foster care for more than 5 years. Of the surveyed inmates who had either aged out or run away from their foster care arrangements, had been homeless at some point during the first year on their own. There's a higher percentage of females compared to males who reported being without a home during the first year after foster care. Because of the trauma foster care youth experiences and how it inhibits their development, foster care youth have low levels of school engagement. They're more likely to be suspended or expelled. They're more likely to use illegal drugs, be involved in the legal system, and unfortunately, foster care youth girls are 2 times more likely to have early pregnancies. A large study of mental health issues of foster care children in the United States reported that frequent diagnoses of anxiety and/or depression are found among these foster care youth. Factors such as emotional regulation, chronic poverty, disrupted and dysfunctional family situations, child maltreatment, as well as foster placement heightens the vulnerability to maladaptation and psychiatric disorder in foster youth. Foster care youth are most commonly African American and white children, but the children don't have the fault. It is the external trauma that affects them internally and that is carried with them throughout their life. It is why foster parents and parents overall need to understand and learn about the consequences of these maladaptive developments, and there needs to be a systematic improvement to advocate the well-being of these children.